There are actually a lot of misconceptions around sexuality, the sexual self, and cancer. One being that people diagnosed with cancer are asexual, right? They no longer have sexual desires or don't want sex anymore. And that may be true for some going through treatment, but not wanting sex does not mean they are asexual. They still have sexual needs, and whether that's sexually intimate, where they're just, again, laying naked with their partner, touching, or it's being touched, getting a massage, there's still those types of needs. The other misconception is that the older population adapts and doesn't care. And I know many 80-year-olds that are very sexually active, that have a really wonderful sex life, that it's devastating when they realize that their cancer and their treatments are going to change that for them, and that nobody told them that it was going to change that for them. So I think there's misconceptions around age that, somehow people who are fertile need more information than people who are no longer trying to have children. There's misconceptions around women who identify as lesbian, that they don't need the same information related to vaginal health because they're not having penetrative sex. Well, they might be having penetrative sex, and they may want to carry a baby at some point, or again, maintaining continence is important for most people. For older men, there is, I think, an assumption that we can just give them the tiny blue pill and it solves all the problems, and Viagra, Cialis, and Levitra are the magic cure to erectile disorder. Those PEI5 inhibitors are absolutely helpful, and they've been a great tool that we've been able to use. However, if a man is depressed, if they're not attracted to their partner, if they're distressed, that tiny blue pill is not going to help them. It's maybe going to, give them a little bit of an erection, but it's not going to give them an erection that is satisfying to them because they're not up here in the game. And so I think that there's also this misconception that if we throw these pills or throw all these lubes or give dilators, that's going to just magically fix what they're distressed about. But we've got to start up here. So even the misconception around I am, thrown into medically induced menopause and my libido is different, and therefore I'm never going to really want to have sex again, or my desire is changed and I can't get it back. And I'll often say when I hear from women, well, I don't even have any desire, but they're talking to me and they're distressed about it, I would say, so you have desire to have desire? And they'll usually say yes, and I'll say, then you have desire, right? Because there is this idea that desire means I get all tingly and I'm turned on really easily, but really, again, desire starts up here. So the desire to have desire is thinking about wanting to be touched, thinking about what it might feel like to be touched, thinking about how it feels good to be sexually intimate, thinking about my body in a positive way, thinking about setting out time so that I can enjoy sexual touch rather than it being rushed, and then probably it's going to be harder to orgasm if you're going to be rushing it. And I think one of the other misconceptions around sexuality in general in this culture is that spontaneity is better than planned. And anyone who's had kids knows that if you don't plan it, it's never going to happen because you're going to have your 2-year-old walking in your room, right? So I joke with many of my couples that spontaneity does not improve anything. And in some ways, it hinders you from enjoying it because cancer and aging in general change sex. So we need lubrications, and we need moisturizers, and we might need clitoral vibrators, and we might need a penis pump, and we might need tools that allow sex or sexual touch or sexual intimacy to be more enjoyable. And if we don't plan, if we just think spontaneously it's going to happen, usually then it means it's painful, it's not comfortable, and we feel discouraged about the result. So planning sex is also important, whether that's sex with self or sex with a partner. You can plan early in the day, and if your partner doesn't like the idea of planning, then they don't need to know that you're planning. It can be spontaneous to them, right? So thinking about sex early and often, and then making sure that for women who have vaginal dryness, that they're using vaginal moisturizers, which are different than lubrications, right? The moisturizers are used a few times a week. Something like Replens would be a vaginal moisturizer that helps with the inside of the vagina. The lubricants are really used just for masturbation or intercourse or playing with a toy. And you need those tools in order for it to be comfortable. So planning rather than spontaneity is definitely an important thing and a misconception that a lot of people have with or without cancer, I think.